Mediastinum is the middle space left in the thoracic cavity, in between the lungs. Its most important content is the heart, enclosed in the pericardium, in the middle part of the inferior mediastinum or the middle mediastinum. The mediastinum is the median septum of the thorax between the two lungs. It includes the mediastinal pleura. As you can see in this diagram, the space between two lungs is mediastinum and the most important content of it is the heart. दो lungs के बीच में जो जगह है उसको mediastinum बोलते हैं, जिसमें हार्ट प्रेजेंट होता है और हार्ट जो है वो पेरिकार्डियम से एनक्लोज्ड होता है और जो मीडियास्टिनम का पूरा स्पेस है उसमें मीडियास्टिनल प्लूरा प्रेजेंट होता है. मीडियास्टिनम is divided into superior mediastinum and inferior mediastinum. Inferior mediastinum is again divided into anterior, middle and posterior mediastinum. Superior mediastinum boundaries anteriorly manubrium sterni, posteriorly upper four thoracic vertebrae, superiorly plane of thoracic inlet, inferiorly an imaginary plane passing through the sternal angle in front and the lower border of the body of the fourth thoracic vertebrae behind. On each side, mediastinal pleura. This is the superior mediastinum. This is the anterior part where there is a manubrium sterni. This is the posterior part where there is a fourth thoracic vertebrae. This is the superior part where there is a plane of thoracic inlet. This is an inferior part where an imaginary plane is passing through sternal angle. Contents of the superior mediastinum are esophagus, trachea, arch of aorta, brachiocephalic artery, left common carotid artery, left subclavian artery, right and left brachiocephalic vein, superior vena cava, left superior intercostal vein, vagus nerve, phrenic nerve, recurrent laryngeal nerve and cardiac nerve, thymus, thoracic duct, muscles and lymph nodes like paratracheal, brachiocephalic and tracheobronchial. Inferior mediastinum, it is divided into anterior, middle and posterior mediastina. Anterior mediastinum boundaries anteriorly body of the sternum, posteriorly pericardium, superiorly imaginary plane separating superior mediastinum from the inferior mediastinum, inferiorly superior surface of the diaphragm, on each side mediastinal pleura. This is the anterior mediastinum. Anteriorly there is a body of sternum, posteriorly there is a pericardium which is not seen in this diagram, superiorly there is an imaginary plane separating superior mediastinum and inferior mediastinum. Inferiorly, there is a superior surface of diaphragm. On each side, there is a mediastinal pleura. Contents of the anterior mediastinum are sternopericardial ligaments, lymph nodes and lymphatics, small mediastinal branches of the internal thoracic artery, the lowest part of the thymus, areolar tissue. Middle mediastinum boundaries anteriorly sternopericardial ligaments, posteriorly esophagus, descending thoracic aorta, azygos vein. On each side mediastinal pleura. Contents of the middle mediastinum: heart enclosed in pericardium, ascending aorta, pulmonary trunk, two pulmonary arteries, lower half of the superior vena cava, terminal part of the azygos vein, right and left pulmonary veins, nerves, phrenic and deep cardiac plexus, lymph nodes, tracheobronchial nodes. Posterior mediastinum boundaries anteriorly pericardium, bifurcation of trachea, pulmonary vessels, posterior part of upper surface of the diaphragm, posteriorly lower 8 thoracic vertebrae and intervening disc. On each side mediastinal pleura. Contents of the posterior mediastinum: esophagus, arteries, descending thoracic aorta and its branches, veins, azygos vein, hemiazygos vein, accessory hemiazygos vein, nerves, vagi, splanchnic nerves, greater, lesser, and least arising from the lower 8 thoracic ganglia of the sympathetic chain. Lymph nodes and lymphatics. Posterior mediastinal lymph nodes lying along the side of aorta, the thoracic duct.